North Shore LIJ, Lennox Hill Hospital, Heart and Vascular Institute, setting world standards in pioneering cardiovascular treatments.
Today, as at no other time in the history of modern medicine, we have the technology and expertise to intervene in the inexorable and progressive ravage of cardiac and vascular disorders that limit the quality of our lives and longevity. The field is now so vast and so advanced that no one individual physician can hope to master the knowledge and the skills. Since 2003, the Lennox Hill Heart and Vascular Institute has gathered an extraordinary and unique group of specialists that work and collaborate daily to provide a level of personalized, compassionate care unparalleled anywhere in the world. Now, with the remarkable support of North Shore LIJ, we are in the position to take our work to another level.
As a recognized international leader in the field of cardiac ultrasonography and the father of 3D echo imaging, Dr. Itzhak Kronzone comments on how they've changed the care of heart and vascular conditions.
We are able to see the heart now in real time, 3 dimensions. We are able to see the anatomy and the pathophysiology, and we can guide the repair of defect in the heart muscle, valves, and the tissue around the heart.
As a world leader in the use of multi-slice CT angiography to diagnose the presence and extent of devastating coronary artery blockage, Dr. Harvey Hecht shares his thoughts and vision for the use of this technology in diagnosing and treating this life-threatening disorder.
At Lennox Hill, we're fortunate to have the best CT technology in the world. This enables us to get non-invasive pictures of the coronary arteries by simple injection of contrast, taking only 2 seconds with radiation equivalent to that of a mammogram. This technology enables us to determine who has coronary disease, who needs a stent, who needs bypass surgery, and who needs just intensive medical treatment.
Dr. Kirk Garrett left a senior faculty position at the Mayo Clinic to join the Lennox Hill Heart and Vascular team. As an interventional leader in the treatment of coronary blockages, here's what he sees as major advances in this area.
The advances over the past 25 years have been truly incredible. We've moved on from the simple balloon angioplasty procedures to the coronary stents, which truly changed the practice. The early stents were very good, but the very powerful new drug-eluting stents have been truly transformative. And the new generation of these drug-eluting stents have expanded the safety and effectiveness of these products tremendously. In addition, we can apply most coronary intervention technologies now through a small incision in the wrist, which not only improves the safety for the patient, but allows us to treat even life-threatening blockages on an outpatient basis.
Dr. Howard Cohen has been treating and preventing heart attacks in patients for longer than almost anyone in the world, and he's pioneered one of the most effective percutaneously placed artificial hearts for those heart attack patients dying from the shock of the attack. This is where he sees things going.
One of the greatest advances in cardiovascular medicine in the past 3 decades has been our ability to interrupt heart attacks in progress by performing emergency angioplasty and stenting, and thereby restoring blood flow to a heart that's starved of oxygen. In addition, in certain patients who present with severe heart attacks and shock, we're able to support the heart with a percutaneous assist device, or assist device that can be inserted in the cath lab, that allows us to support the patient until the patient can be bridged to more definitive therapy.
As an interventional cardiologist, a vascular specialist, and a pioneer and leader in the largest carotid artery stent program in the country, Dr. Shriram Iyer speaks about some of this incredible work.
Stroke is the 3rd most important cause of death in the United States, and there are more than 700,000 strokes every year. About 1/3 of these strokes are as a result of problems or blockages in the carotid arteries. And it's my privilege, together with Drs. Rubin and Dr. Vitek, to be part of that team that pioneered carotid artery stenting as a definitive treatment for carotid artery disease. Not only do we have the world's largest experience, but our results are probably amongst the best in the world. When we talk about results with carotid stenting, two questions are often asked. Does carotid stenting prevent stroke? And the answer is yes. And do these stents re-narrow or re-stenose? And the answer, fortunately, is no.
Dr. Robert Rosen is an internationally renowned vascular interventionalist whose patients come from all over the U.S. seeking his expertise in treating vascular malformations. He shares why he left NYU to join the Lennox Hill team.
To be honest, for years my dream was always to work in a multidisciplinary environment, and the opportunity to work here with really unique specialists in multiple different areas combined with Lennox Hill's tradition of patient-focused care and the nursing and the facilities was an opportunity I couldn't afford to pass up, and it's really surpassed my expectation.
As an acknowledged pioneer of many techniques for treating valve and structural defects in the heart, Dr. Carlos Ruiz talks about the Structural Heart Program at Lennox Hill Hospital.
We at the Lennox Hill have one of the best structural heart disease programs in the world. We have proven to have the team that works together, not just talks, works together. Surgeons, interventionalists, imaging specialists, clinicians, anesthesiologists. Now we are at the point that we need to operate the facilities where we can all work together. And therefore we need a new hybrid operating room with the most advanced technology in imaging.
Dr. Manny Subramanian has opened the door to minimally invasive cardiac surgery by pioneering minimally invasive heart bypass without the use of the heart-lung machine since 1994. Here's what he sees on the horizon for further advancements in cardiac surgical care and intervention.
Since 1994, we've been very busy in developing and pioneering other facilitative enabling technologies like vascular connectors, robotics, and various other assisted technologies. We are one of the busiest closed-chest robotic-assisted cardiac surgery program in the Northeast, and we have been now collaborating with the interventional cardiologists to develop a truly one of the best hybrid program which benefits the patients from both worlds of interventional cardiology and cardiac surgery. We truly are set for the next century to be the pioneer in the least invasive type of cardiac treatment.
Dr. Nirav Patel is the director of the Robotic Cardiac Surgery Program. Working closely with Dr. Subramanian's team, Dr. Patel has developed extraordinary skills in minimally invasive robotic surgery and valve repair.
Robotic technology enables us to visualize the heart in a 3D high-definition magnified way. The small, tiny robotic instruments enables us to perform precise valve repair and coronary artery bypass surgery in a totally closed chest fashion without using any incisions.
Cynthia T. Doplaise is a registered nurse and the mother of a 35-year-old cardiac patient of Lennox Hill Hospital. She tells the story.
I firmly believe if my son was not brought to Lennox Hill Hospital and Dr. Cohen was not here with the tandem heart device, we would not be having this conversation today. When I got that call on Wednesday morning that my son had a sudden cardiac arrest, I was devastated. When I arrived at Lennox Hill Hospital, Dr. Cohen spoke to me and told me that my son's left side of his heart was essentially not functioning, that the only choice was to put the tandem heart on him. He is cognitive, he is doing very well, and hopefully within 2 weeks we'll be taking him home. I'm Cynthia Doplaise. I am a nurse and I understand the importance of good care. I understand how time and team are important, and I'm very pleased and lucky, and I firmly believe that Lennox Hill Hospital saved his life.
At the North Shore LIJ Lennox Hill Heart and Vascular Institute, we are committed
to providing extraordinary levels of expertise and compassionate care to patients,
while providing cutting-edge organizational leadership in first-rate facilities
to patients, healthcare providers, and community partners.
We strive to provide collaborative, comprehensive, and evidence-based approaches
in the diagnosis and treatment of challenging cardiac and vascular conditions,
as well as to transform standards of care worldwide and to find progress in the field of cardiovascular medicine and nursing through innovative research and unparalleled education.
North Shore LIJ, Lennox Hill Hospital, Heart and Vascular Institute, setting world standards in pioneering cardiovascular treatments.